Yeah.
Now, a new study reveals that drinking sugary drinks leads to 184,000 deaths each year worldwide. Fox News Medical Aid Team's Dr. Marc Siegel is here. 184,000 worldwide deaths out of 5-6 billion people
per year.
So now what? We get rid of sugary drinks, or I mean, I don't want to sound.
Let me tell you
I don't want to
new.
sound flipped about it, but it's a percentage-wise, that's like 0.01% or something like that. 2%.
Let me tell you what's new. It's the first time they've done a survey or a study looking directly at the sugary beverages. We all know that obesity leads to millions of deaths per year. But you know what? Having too much sugary drinks leads to obesity, and it leads to diabetes. Out of those 180,000, 130,000 of them were due to diabetes, because the more you weigh, the less effective your insulin is. The less effective your insulin is, the more the risk of diabetes. Now, this is not proof either, Charles. Your point, you know, that it's only a small number of deaths. Well, any number is large, but it's also not proof. It's not proof, but I actually believe it. I think that I think we're drinking too much.
But here's what I'm worried about.
Japan, they don't drink this stuff.
This is what I'm worried about, though. And we just had a Supreme Court case on the EPA and mercury and the goals of getting rid of such a small amount of mercury in the air and to make these utilities spend $10 billion on it. The Supreme Court said that was ridiculous. It's got to be some sort of cost-benefit analysis, and I'm worried that these become the foundation for government intervention in our lives, and they just say, we can't have sugar, or we'll tell you how much you can have. That's what scares me about this.
Which I am completely against, by the way. I don't want the nanny state to get involved here. I'm on your side with that. But on the medical side, I think pointing out the harm here is good, too. It's bad for teeth.
Right.
You know,
we're killing ourselves.
I mean, I put seltzer in my freezer, in my refrigerator instead of Coke.
Right. We're killing ourselves. Americans are killing it. We are killing ourselves. We know that, right? And on that note, I want to ask you, because you have an op-ed on Obamacare and how it might be really, really good for these insurance companies
to go across state lines. I see what you're saying. Yeah, because I think that the government is feeding in the insurance company. Of course, if you say to an insurance company, here's another 16 million people, you know, feed your coffers, and then they start with these high deductibles. So Obamacare, as it is right now, there's more and more people for the insurance companies to charge. The government is paying the subsidy, so it's not coming out of the person's pocket. They don't feel the pain, but when they go to the doctor's office, they're hit with a $5,000 deductible, so the damn insurance doesn't cover anything. And also, I want portability, Charles.
Also, these premiums go through the roof, and people who don't get these subsidies do have to pay those premiums. And to your point, so the people who have Obamacare, high deductibles dissuade them from going. People who don't have Obamacare, the high premiums dissuade them. So it's a lose-lose for everyone involved.
But I want to emphasize that that's the 15%. The 85% are subsidized, meaning that you and I are paying, the taxpayer is paying. So the solution is more competition. We've said it from the beginning. Portability across state lines of insurance. Then you could say, look, I don't want to pay that premium in New York. Let's go to New Jersey.
You realize there's been less competition. There's a massive competition. There's massive consolidation. There's going to be 2, maybe 3 major health insurance companies by the end of the year. Doc, great stuff. Really appreciate it.
Great to see you.
All right, guys.